you everyone for joining us. And this is Mukesh from Headstart Network Foundation. I'm working with the Innovation Hub and Government Engagement at Headstart Network. We have been doing a lot of events and a lot of activities related to impact the tier 2 and tier 3 cities in the startup ecosystem. Many of you might have been part of a few of initiatives, few of the program in the past 1 or 2 years. But just to give an idea for the folks who are new who have joined today us, they might have not been part of our previous sessions and all. Startups September is one of the key initiative of Headstart, where we have been engaging with various stakeholders to bring them on board on a single platform. As part of this, we have also launched something called Bharat Pitchathon, where we have been trying to give funding opportunities and pitching opportunities to startup working from again to a tier 2, tier 3 cities. Last year, we had wonderful support from various stakeholders. We have hosted 210 plus experts in 56 plus sessions and 20 plus offline meetups, again making it one of the biggest event in the startup community. This year again, we are hoping to have almost 100 plus event. We already have hosted 17 plus pitching sessions under the Bharat Pitchathon umbrella, and a total of 26 plus will be hosted over there. We have received support from 30 plus funds, VC funds, and plus 80 plus regional ecosystem partners to complete and to host these all sessions. Today we are having very wonderful panel with us, and for that I'll be inviting Mr. Kiran to introduce panel members plus as well as to take this session further over there. Handing over to you, Kiran.
Thank you, Mr. Mukesh. Wonderful to know the activities of the Headstart spearheading the innovation and startup ecosystem in India with your volunteerial experience. Good evening, everyone. It's a humble and good experience to have a panel of people who has their own experience in their own fields. I'll introduce myself and then deep dive into the panel discussion, beating the pandemic blues, which is the need of the hour. I'm Kiran Vuppala. I'm a bona fide biotechnologist having 12 plus years of experience in the technology process improvement, product and project management, funding, as a researcher, innovator, and now as an entrepreneur. Presently, I am leading the Mazumdar Shaw Medical Foundation Technology Business Incubator as Head of Operations by bringing my expertise in order to nurture the early stage life sciences startups specifically, right from the ideation till the commercialization strategies, bearing multiple hats as a social innovator, entrepreneur, and a fund specialist. Apart from that, I own a startup. I have started my own startup called Cerealian Nutritech Private Limited, wherein we develop nutritional interventions to spearhead the OTC pharma sector in India. With this, I'll go to the context of the session, that's beating the pandemic blues, the Indian healthcare and biotech ecosystem in India. So I would create set a context before we actually go introduce each of the panelists. Startup ecosystem in India is growing at an exponential pace. As you know, 90 plus of top 108 unicorns have just emerged in the last 5 years. And out of which, for the year 2021, the combined valuation stands at a whopping 341 billion valuation, with the firms ranging from the Medtech and in the HealthTech side. And then the recent addition into is 1mg being nominated as a unicorn. And then there are many good startups which got acquired in the due course of time, like NetMed, Pharmacy, etc. It's not restricted only to the startups, but even the big bulls of India like Tata, Reliance, Flipkart, and even Amazon are emerging and then looking formally into the space. And then as per the recent report by INC 42, India will witness around 21 billion market size in HealthTech segment and 170 billion market size in the pharmaceutical preventive healthcare specifically by year 2025, making the India the land of opportunities for innovation ecosystem. And then just to give a more glimpses to it, according to the survey by the CNBC and the Startup India, India is home for about 3,500 plus startups in the HealthTech domain. And then in the year 2021, all the startups raised a corpus fund of around 2.2 billion through 121 investment rounds. Wow. And now with just few months left in the 2022, the number has still emerged as 7,500 plus as per the statistics. And then this is a sector which has created innumerable ecosystem and helped the Indian ecosystem specifically during the pandemic times. With this, and then today, because of the various support systems and then initiatives by different government of India agencies like DBT BIRAC, DST NSTDB, DST Nidhi, Mighty Tide, AIM Niti Aayog, they have plenty of opportunities for the researchers and the startup founders to start their entrepreneurial ecosystem through various of the support schemes like early seed grants, seed funds, And then with the eminent incubator and innovation ecosystem, they have an access to R&D, access to facilities to transform their idea from the lab into a commercial, tangible end product, and making a startup a reality. But however, there is a flip side to it. Due to the long gestational period, probably in the health tech space, many of the startup founders find it difficult to cross the valley of death. Typically, from the proof of concept to the commercialization strategies, owing to multiples of reasons. And then they find difficulties probably to scale it up. And then they find issues in terms of IP patenting, patent landscaping, regulatory framework, and then different business models, to name a few. So today we'll discuss and understand the opportunities, possibilities, and growth in this particular domain from the eye of the experts we have today with us in the panel: Dr. Nambiar, Mr. Ajay Rungta, Dr. M.S. Narayan, and Ms. Ishita Shively with us. And then we have a mix of investors ranging from investor, researcher, medical professional, and a corporate as also, we would like to discuss more how we can transform these early stage innovators to a big giants like BioTech, who is a successful example which we can shown during the pandemic era. And then we don't want to limit only to one. So we want hundreds of BioTechs. How we together in an ecosystem can make this happen into a reality. With this, I'll start the session with Dr. Uma Nambiar. I'll give a brief intro of her, and then I'll start with the questionnaire. Dr. Uma Nambiar is the Executive Director at Jimcare Hospitals, Chairperson DHIA, Vice President TSA Kerala Chapter. She has over 3+ decades of experience in strategic consulting, healthcare policies, commissioning new hospital, process re-engineering of the existing hospitals, process standardization, quality and care, and go on and on and on. So, and then she is also a mentor to startups in the healthcare IT sector specifically, and serves in the board of various corporate hospitals in India, Sri Lanka, and Africa, to name a few. Dr. Uma did her MBBS and MS from the Armed Forces Medical Colleges, Pune in 1982. With this, I'll hand over to Dr. Uma Nambiar to share her introductory remarks. What do you, ma'am?
Thank you so much, and thank you for the kind words and introduction. So, technology has been a passion, as well as because I'm a neurosurgeon. So amongst the medical specialties, I think the least tech shy people are the neurosurgeons. Okay, so therefore it is not strange. And also I'm from Sri Chitra, where biomedical technology wing was, set up first by Dr. Valiyathanan. So I'm very, very closely connected with biomedical technology, as well as, the felt need for amalgamation of the two, and for medtech innovation to come out of India. And now I'm working with the Indian Institute of Science to actually realize that hospital, which is going to be the dream hospital that at least I would have worked in, where innovation and research in health tech and is going to be the prime focus. So that's how I am, what I am doing right now. And I'm really very, very happy to be part of the panel and to address some of the questions and interact and learn from everybody here.
Thank you, ma'am. Thank you for the introductory remarks, and then lovely to have you here in this August panel. With this, I'll put across a question, ma'am. You are working with India and other African healthcare ecosystem during the time of pandemic. Could you share some of your experiences you observed in both the countries? What could be the differences in dealing with such a bizarre cases like COVID? And then how did the digital healthcare infrastructure change the face of it? Or would you agree that the COVID changed the digital healthcare in the country?
Yes. So not necessarily in the same order, but let me tell you that digital technologies have been around for a long time. And we have all in the healthcare space, I'm sure the other panelists will agree with me, that we've always looked at, trying to find a solution for access and affordability and quality and all of that stuff. Suddenly when COVID happened, and what could never, no technology could disrupt the healthcare as much as this small virus did. And if we have to look at the good, bad, and the ugly of COVID, this is the best part that happened. That suddenly the tools that had been there and not being used appropriately suddenly started to be used, and the whole world realized the importance of digital technology in healthcare. So digital has, far more uses than just, telemedicine. And this is another thing that, one has to realize and make sure that we hold on to the momentum and make sure that we utilize the power and, harness it completely, because we have now learned it. So yes, it disrupted the way we look at healthcare. The public started to seek healthcare completely differently. Their expectations from the healthcare industry have also changed. The doctors have also suddenly, they are not shy of using digital technology. They are not afraid, and they do not think that their careers are at risk, which are some of the fear factors which they had in mind. So yes, digital technology has changed a lot. What COVID did also to the world, if you look at the global framework, the dependence on other countries for items, like the supply chain disruption that happened because there was the let's say the lockdowns and transports were not available. So like say, just as it happened for the PPEs for India, where we like didn't manufacture any on our own, and we suddenly then became the number 2 in the world. For the African countries, they were like really, for their entire pharma, they depended on India. For a lot of other consumables, they depended on China and India and a lot of other countries. And suddenly, you found that those countries were left with nothing at all. So it was, it was a bizarre situation. At the same time, it was a realization to many countries that self-reliance has to be there. So many countries have learned that. India has become self-reliant in many, but the cooperation of the countries cannot happen just because there is a willingness to do it or there's a political will to do it. You have to have the other logistics and infrastructure. So if there's a lockdown and the aircrafts are not going to fly and the ships are not going, then what can you do? Your willpower cannot reach things there. So this was a big factor. So this many countries now are trying to figure out as to how to do at least some indigenous manufacturing, some things to be, their manpower. Medical tourism completely shut down. So a lot of people from Africa, which were routinely coming to India for treatment, they couldn't get their treatment. So a lot of such problems happened, and it's a learning for the world that much as we rely on each other and cooperate with each other, we also have to be self-reliant. Another biggest learning, one more big learning that happened was that if you don't communicate with each other and don't cooperate with each other, you cannot survive also. So look at the healthcare industry. Public was working separately, private was working separately, everybody was working in their silos because we were afraid that nobody should take away our patients or our secrets or whatever it is. But in the history of mankind, so far, no vaccine has been developed in 1.5 years. Why did it happen? Because globally, every country that could cooperate in any way or contribute in any way with either data or technology or their labs, they did. Almost every country worked together to have so many vaccines produced in a period of 1.5 years. So just as the global unity or the small the world that we have today, that was responsible for the spread of COVID, but that was also responsible for use of digital technology and communication to develop a vaccine that could be developed in 1.5 years. So COVID has really taught us many things. One is to cooperate with each other. Number 2 is to be self-reliant in many aspects. And for healthcare, it is about use of digital technology to improve the access and to see how it can further be used to improve quality and affordability and all the other dimensions of healthcare that we always look at. Yeah, thank you. That's what I needed to say.
Thank you, Dr. Masa, putting that across, that we need to be a self-reliant and at the same time we need to cooperate to share the healthcare practices among the countries as such. With this, I'll get back to you again with the next set of questions, and then I'll move on to the second speaker, Mr. Ajay Rungta. Ajay Rungta is the Chief of Staff to CTO at Practo, healthcare company wherein for the last first decade he is building and supporting the venture. Practo, as we already know, that a world's leading healthcare platform that connects millions of patients with hundreds and thousands of healthcare providers around the world in order to make people take effective healthcare decisions. And at the same time, he is wearing another hat as an active social investor at Rangde, which is India's first and pioneering social peer-to-peer lending platform with a mission to revolutionize credit access and at the same time enable last mile financial inclusion. And in the year 2019, I think Rangde was provided license for the RBI to do the social peer-to-peer lending. And then Ajay graduated from the BITS Pilani in 2006 and did his master's from computer sciences in 2010 from the BITS itself. I'll throw the session. I'll throw the platform to Mr. Ajay to share his introductory remarks. Over to you, Ajay.
Hi, thank you, Mr. Kiran. It's a pleasure to be here, and I'm thankful to Headstart to invite me here. Firstly, I think Dr. Uma has spoken all our points which we had thought possibly there. Right. I mean, but true to the fact, right? We say what pandemic did to us, and there were obviously bad side of things, but there were a lot of good parts to it. And if so, being in HealthTech myself, I've been here in Practo for 11 years now, and I've seen the entire HealthTech journey of Indian ecosystem, right? Whatever we have built, and it's been I mean, things like, as we say, telemedicine, right? Telemedicine as a platform we had built pre-COVID, though the number of users used to come were very small, but possibly early on we knew that someday this would definitely be useful. And I mean, bang on when our honorable Prime Minister announced the lockdown, the tool which he had built a year back was useful. And then we had, I mean, it was not that out of the scratch, we had to build from this start, right? And there were a lot of other products which we had built, some sailed through long time, but few like big companies also shut down some of the businesses. We had also shut down that certain things, especially in India, people are not used to. And though whatever positive parts to pandemic, that everything is online and people got used to, even our kids getting, I mean, learning online, which were never thought earlier, right? People got used to online, and then even a trust on the system that, okay, I can talk to doctor on online and then take medicine, buy or even order that online, and then possibly, I mean, survive, right? And one of the points which generally doesn't get discussed and what kept us going during the pandemic and in the past also is you do have some stories from people, from your relatives who has used the online platform, consulted a doctor or some other, whether it is medicine or say, so I know 2-3 personal stories also where people shared that when I was just talking to them and then, oh, I mean, I used Practo and I saved my kid or my uncle or someone. That kept us going, right? Irrespective of the fact what is happening in the world, right? And that's the mission. I mean, that's what we are here for. Though we are not doctors ourselves, but we sometimes also felt that we were also COVID warriors, right? The technology which we provided helped save lives. So that's all from my side as an introduction.
Thank you, Mr. Ajay, for the remarks. And then I'll put for this question to you because the Practo is the leading #1 telemedicine company from the last 15 years, and then you are also a social investor from the last 13 years. So, how do you see this hype in the market for the health tech segment and its growth? Also, do you see this as just another bubble, in your opinion, created by the situation?
So, when you say words like hype and bubble, right? Though we might look at telemedicine as one area where we think that possibly it's an hype, but see, companies like us have been there for 14 years now in health tech only. We have built clinic management software, hospital management softwares. We were the first to do online appointment booking, right? I mean, even today it is not people are not very used to or don't trust the system to book an appointment online, but everything else we do online, right? Whether it is food, travel, delivery of items, everything else. So, and when it comes to telemedicine, if we specifically say whether it is, so my point is, it is as such, health tech as such is not a bubble, right? It existed and it will exist for as long as we will survive, right? As long as humans are there. I always say that as long as humans are there, health tech will be there. And for the telemedicine part, it is very simple that though like we built a tool earlier but never used, I mean, it was very few people coming to it. But I think the part of the people and sometimes it is the basic ailments, right? If you have some fever or anything, you need not go to a doctor and still consult. And as long as the doctor also at the end says it doesn't get fixed in 2-3 days, do visit a doctor in person, right? And there are a lot of times which we myself have used for my kid or family members, where you know that it's just a fever or just a throat infection and you just want to double check whether things are fine or not. And advantage of telemedicine is always that, so it so happened yesterday my kid was sick and then we consulted online and doctor gave medicine, everything is fine. But that last thing, right? I had that 2 questions more and how do I ask? You can just type and then doctor will respond. And this is just the telemedicine part. And earlier it used to be a chat based, but now you do video consultation, you know, doctor, you also can see doctor profile, you understand how telemedicine works. And on top of it, when you add that, okay, you click button and someone will deliver medicine in 2 hours, or someone will come and take blood and the reports also will be online and then someone can review, all of that will always remain, right? I mean, to whatever extent, obviously where the touch and feel is there, or you actually need to take pulse, put an injection, or do a lot of things, right? There's so many equipments that is difficult in telemedicine or any kind of online platforms. But definitely it is not at all hype or just a COVID created situation. Definitely it helped us make awareness come to everyone that certain problems can still be solved online. And as Dr. Uma mentioned, right, that fear of doctors to the doctors or clinics and hospitals that my patient will go away, my business will shut down, and there are a lot of points, right, which that fear, or whether I am useful, I mean, I can actually do video consult or not. That was also a point, right? Doctor, when we onboarded for the first time, they said, no, I cannot do video consultation. People should come to my clinic. But especially during the wave 2, when things were very bad outside, and we knew, because of the last 1 year of COVID, we knew that obviously the demand will shoot, and we had to kind of hire doctors like for 2 hours, 4 hours kind of a slot, that so that we can meet the demand and supply, right? And doctors were happy to do online consultation, the video consultation, and then they got used to it, and then obviously that's how we could also scale the telemedicine part. So I think it's not at all a hype or just a temporary thing. There are things which we will get used to online. There are things which are only possible offline, and a mix of both, as long as you are able to do, whether it is converting an online conversation to in person or to a surgery or to other things, definitely is the future.
So, as you rightly said, all these telemedicine platforms, either in the rural, semi-rural, urban platforms, it's the first gateway for the clinicians so that they can go for an in-person for a regular checkup, especially during the end of pandemic. So the telemedicine has changed a lot.
So Kiran, just to complement what Ajay said, you know, one of the reasons why telemedicine could take off during COVID was because the government announced the telemedicine practice guidelines, which legalized telemedicine and allowed doctors to charge for telemedicine. Before that, there was no way to do it. And sometimes you were penalized because you advised on phone and some complication happened to the patient, and doctors have had to actually pay a penalty for that. So this legalization through guidelines helped this. And this should have come a long time ago, but I think, you know, it was a good thing that happened.
So just to concur the same point, it was a relief for us when it came, right? Because at some point in time, whether it is, as you say, and you know, medicine delivery, which has been questioned a lot of times till now, and it's not yet been, if I remember, no guidelines have come yet, right, in terms of online medicine delivery. But we were doing it, and as long as the moment it got legalized, kind of we could just comply with all the rules and then do the business happily, right? I mean, otherwise it was difficult to convince doctors, and especially if you are a government doctor and then they say, no, I cannot do this, right? Possibly there might be other reasons so where they cannot do, but it definitely helped us. And in a lot of places, because we have been doing for so many years, somewhere we have been contributing to the guidelines, whether it is this or other guidelines on NDHM and of the likes. Practo has been there for working with the government to create those guidelines as well.
Yeah, good. I'll come back to you, Mr. Ajay, again, and I'll move on to the third speaker, Dr. M.S. Narayanan. Professor Narayanan is a principal scientist at IIT Madras Bioincubator and a DBT Ramalinga Swamy Re-entry faculty at Department of Biotechnology, IIT Madras. So he brings an interdisciplinary experience spanning from the various segments, right from fundamental biotechnology to applied nanobiotechnology and then point of care molecular diagnostics. So he brings immense experience in terms of the scientific management, research, and innovation. So to his credit, he has 30 plus projects, 50 plus international conferences attended, and then 30 plus workshops. And then he has also worked as senior scientist as research manager at Shy Life Lab, Stockholm University, Sweden, and is also the recipient of many prestigious fellowships like Marie Curie Research Fellowship, Max Planck Fellowship, and DBB Visiting Research Fellowship, to name a few. And then he was awarded PhD from the University of Potsdam, Berlin in 2012. With this, I'll hand over to Professor Narayan to share his introductory remarks. Over to you, sir.
Thank you, Kiran. So at the outset, let me take this opportunity to congratulate Headstart team, especially Mukesh, Kiran, Gautam, and all of you, who always take this wonderful initiative to bring important topics across the table to enlighten the masses in the innovation ecosystem. So this is not an easy task to integrate, diverse kind of people and topics in the same platform. For instance, in today's platform, we have investors, leading clinicians, and clinical administrators, innovation ecosystem enablers, all of us on the same table. And this gives us not just pleasure, but also a platform to convey the gaps that needs to be bridged in order to further the ecosystem ahead. So this becomes very interesting and important, especially for an arena like healthcare. So broadly, I'm a biologist and a biotechnologist by education, who turned out to be a biomedical engineer by practice or training. So in this transition phase from a biologist to a biotechnologist and a biomedical engineer, I happened to witness small gaps, but very critical ones that often escapes attention in terms of problems in healthcare. So how to bridge these gaps become the key points where one needs to focus in terms of innovation and creativity. And today, somehow or the other, we see that the healthcare startups exactly try to address these bridging the gap phenomenon, but in their own humble ways, which require a lot of energy, a lot of efforts, and a lot of resources, not just from within their own self, but also from a lot of supporters in the ecosystem, which becomes very important. And having said that, another thing we need to also realize is that this is becoming more an interdisciplinary approach. So when we say interdisciplinary, we realize that now no more these boundaries of biology or physics or chemistry or material science or engineering or even medicine for that matter, all of these exist. Rather, everything becomes a melting pot in a positive sense where one tries to understand the language and the communication terminologies in the other field, which has enabled us all to cross this pandemic in a very stable, but then in a slow and steady pace. So 1.5 years, as Dr. Uma mentioned, is a very marvelous period in which a major invention like a vaccine for a specific pandemic could come out. But all the more interesting is also a multidisciplinary hand that all went in together in order to create this toolkit, which cannot be, avoided giving the due attention it demands. Multidisciplinarity on one hand also leads to something called as an intersectoral approach. So when we say intersectoral, it means that the academia slowly leans on to moving towards industrial bridging and also bringing in other sectors like clinics, for instance. Again, Dr. Uma beautifully mentioned about the initiative from ISC. So at IIT Madras, we are also trying to mimic that model where also such medical initiatives are being picked upon. But all of these initiatives require huge efforts and huge resources, both from the talent pool as well as from the technical expertise. And that is exactly platforms like this are trying to address, I think. So with this introductory remarks, I think that healthcare technology and healthcare biotechnology in particular is booming not only during this pandemic period, but also in a stable way, carrying its own torch towards the future light.
Thank you for your comments, and I'll take this opportunity to appreciate the Headstart team to put across all the panelists and then to discuss on the eminent topic of the day. With this, I'll ask you a question which is close to my heart as well. So being a researcher, you have come across many people, students of you, who would like to transform or shift the PhD thesis into a tangible commercial product. So, considering your experiences, what do you share or what do you give to the attendees over here? The do's and don'ts of starting a startup company, and then what all the support structures we have in place to make the commercial tangible product by way of a startup a reality.
Thank you for posing this very practical question. So let me start like this. So around 15 years, I was based in a European innovation ecosystem. Especially the last 5-6 years I spent in a hospital ecosystem, Karolinska in Scandinavia, and having traversed this phase and moving into the Indian ecosystem for the past 2.5 years, the major difference I noticed is the modular approach that is operative here. So in the West, be it Europe or in the United States, what we usually see is that a single entity, something called as a research technology organization, handles everything starting from innovation, moving towards R&D, slowly scaling up, and then also pushing them towards commercialization. On the other hand, in an ecosystem like ours, which is very powerful in its own way, we somehow see that everything operates in a modular fashion. This has both pros and cons of its own self, but I wouldn't, there are no thumb rules that directly dictates you the do's and don'ts. But from our experiences here, be it in terms of, faculty entrepreneurship, or be it in terms of student entrepreneurship, or be it also in terms of entrepreneurial ventures from very humble and powerful entities who come out from tier 2 and tier 3 cities, which require huge attention. What we notice is that there are two critical points where many of these healthcare startups especially have a huge pitfall. So they require a strong handholding, especially in these two transition phases. So the first phase is not when they transit from innovation to R&D. That happens very spontaneously, very smoothly, especially with a strong ecosystem that is booming, gaining attention here. But rather, the step even before innovation. So what happens is many of us who want to start an innovative approach lag the view towards potential market. So what we do here is when we get a startup, be it in healthcare or any other domain of biotechnology, we motivate them to undergo a hardcore training. When I say a hardcore training, it's not a period of days to weeks, but rather a period of 2 to 3 months just to identify their potential customers. Because most of us come with a notion that our innovation is a solution for many problems. Yes, it could be, but rather for whose problem is the critical question there. So to identify this also attracts investors, especially like what Mr. Ajay was pointing out. It also attracts the potential areas where such investments could be made. So that is the first important area. And the second transition point is where scale up to commercialization takes place. And unfortunately, this is the area that demands, as I said in my introductory points, huge infrastructure and resources. When we say infrastructure, especially healthcare startups, they cannot afford to build their own infrastructure, which run easily from a few tens of lakhs to a few crores. And not all of these startups, even with support from very big funding agencies or investors, could manage this. So only ecosystem enabling entities can support such ventures. And on the other hand, in addition to infrastructure, the resources that they need to bring in terms of, manufacturing units or in terms of commercial packaging kits, etc., especially to align to the goals of India as a biomanufacturing hub, when we talk about Atmanirbhar Bharat or self-reliant in India, all these become critical to be addressed in this phase. And these are the major problems where one needs to focus their attention as a healthcare startup, in my opinion.
Thanks, Professor Narayanan, for putting that. As you rightly said, identifying an idea is one stage, and then putting across the market potential and the market needs of the products is another way of the corner to look around before one actually needs to start a startup. We'll come back to you again, and then I'll move to the last speaker, Ms. Ishita Shively. She's currently the VP for...
Yeah, sorry to interrupt. Just one point on the what Dr. Narayan pointed out on the funds, right? Can do limited with limited funds, and even to the extent of what you can build or expand and all in healthcare is very, very difficult, even in many years' time. And Right. That's and if you are doing in a startup, I mean, if you have money like of the likes of Ambani and Adani and all, it's easy to an extent that you announce a fund that will invest this much in this health tech or things, but otherwise it is very difficult without funds.
Right. Probably there are funds for the early stage ventures in the grant space from the 52 lakhs. And then when the moment you have the POC and then move to the scaling up and the commercialization, there's a dearth of funding, as you correctly said. So hopefully the governments will pitch in and then to come across the follow-on investments rather than supporting the early investments only.
Yeah.
So with this, I'll move on to Ishita. So Ishita is currently the VP of Apollo Research and Innovations, a division of Apollo Hospitals. And then currently she's heading the vertical of strategy and business development. She has overall 15 years of experiences spanning from consulting, merger and acquisitions, marketing strategy, and business development to MFU during her stints at Apollo Hospitals, HP Inc., Grant Thornton, and Jubilant Organosis Limited. Over to you, Ishita, for your introductory remarks.
Thank you, Mr. Kiran. Okay, at the start, I definitely want to say thank you to Headstart, because already by listening to the other panelists, I think I have learned quite a few things. So I'm quite excited about the rest of the discussion as well. So in terms of my opening remarks, I think there are 2 points that I would like to highlight. One, as part of Apollo and having dealt with a number of startups and a number of innovators, both domestic and international, I think there is a common thread, that there is a common gap that we often see in the hospital setup, and that something that Dr. Narayanan also touched upon was having an idea and developing something versus the usability and the actual need for it in a clinical setup. And I found that a large number of startups, they put in years of work, they get funding, they put in their personal money, they get government funding, but they have never really spoken to a doctor who is the final person who has to use it, right? So after 2-3 years of working, you've done research, you've built a proof of concept, and now you really want additional funding to take it to the market. You even in your mind identified what is your market or who are the people who are going to use it. But actually, when you bring it to the people who have to use it, a lot of times they don't agree with the usability or the case in hand. A lot of them will say, oh, it's good, but it's not the topmost on my priority. Or we see, especially in cases where people have created things in the US and Europe and now are looking at other markets, and obviously given the size of the Indian market, you can't ignore it. So they're trying to bring their products to India, and they don't understand the Indian market. It's not one healthcare market. It's a number of markets grouped together, right? So they don't understand how it works. There is no concept of insurance. Everything is out of pocket. And in a country where you have enough labor at hand, you don't need a lot of the products that come in because you have enough people to do that. So there is a mismatch in terms of products being developed and the need. And I think that is where hospitals and hospital structures can play a very key role, because if you have this interaction at an early stage, when you still have an idea, and that's what we tell the startups that come to us. A lot of them come at ideation stage, a lot of them come at quite advanced stages, and we try and we set, depending on what stage they're in, we try and set up immersion sessions for them. Let them actually sit in a hospital, see how things work, talk to a doctor, observe what the nurses do, right? And you'll really realize where the real gaps are, and those are the gaps that you need to address, not the other way around, thinking that okay, I think this is a gap, let me create something, let me invest time, money, make it, and then realize it doesn't work. So that is one area I think increasingly we need to address. And definitely clinicians, hospital systems can play a big role and should be involved in a lot of these development works. The other point that I wanted to talk about was more related to the pandemic. So, yes, I think in a way you can say that every cloud does have a silver lining. And for the innovation industry, especially healthcare, the pandemic, whatever chaos it created, we did see a lot happening in that space, right? Whether it was small companies coming together to make low-cost ventilators, or manufacturing setups changing what's their core business and actually trying to manufacture PPEs and masks, and to ensure that everyone gets what the demand is. We've seen a lot, as my own team works a lot on clinical testing and validations. We've seen so much happening on the on the drug testing, the vaccine testing, a lot of activity, and at the same time a lot of people volunteering to be part of that. I think that has also been seeing people come together to actually help each other, I think has been a very positive outcome of this entire pandemic, right? So and yes, the silos, I think breaking those silos. Till now we've all worked individually. I think Dr. Uma talked about it, saying people were scared that you'll get to know our secrets. I think suddenly there were no walls. People just wanted to work together. So whether it's a tech company with a hospital or a doctor, you can imagine in a hospital suddenly Apollo Jubilee Hills is crowded with people, and we suddenly saw the hospitals absolutely empty. So how do you? It's not like somebody's not still having a stroke or a heart attack, but they're not coming to the hospital because they're scared. So how do you deal with that? How do you reach out digitally? So I think Ajay also talked about this, that digital technologies, video consults, yes, they picked up big time during the pandemic, but I think they're here to stay. Suddenly you realize you don't need to go across cities to meet an expert. You can just pick up a phone and speak to them virtually. And it's brought patients and doctors a lot closer. Doctors are now more convinced. They are more comfortable, at least with that initial call. And I think it's really going to change the face of healthcare, the way we are seeing new advancements and adoption coming across the globe, across social stratas. Everybody's open to looking at these ideas. So I think those are the two key points that I wanted to talk about.
Thank you. As you rightly said, involving clinicians to de-risk or validate the technologies before they go for the commercialization is good to have in the ecosystem, because India is an ecosystem where everyone wants a doctoral accreditation or a card saying that, this doctor has approved it, and then we are good to go and good to use it. And then with that, I'll have a follow-on question on you, being a business expert working in the Apollo healthcare domain. How would you suggest, or what would you think any typical healthcare startup should work on design to make a successful venture? Say, for suppose in the pitching, you would have attended many pitching events. What are the typical pros and cons of startup investment, and then to make it a successful venture?
I think the starting point, of course, has to be a well-defined problem statement. I think that is the basis on which any successful venture will happen, right? So, and for that, you need to speak to multiple people, multiple experts, and then identify. So, starting, if you have a strong base and then you build up your product, the other part would be, so start with the good question, come up with an answer. And when you are entering all these events where you're pitching your ideas and you're asking for funding, I think it's very important to be extremely aware of the market and the competition. A lot of times we see people so engrossed in their own technology and showing how it is best in class, but it's very important to also showcase to potential investors that maybe just a slide, right? These are my competitors, both domestic and international. First of all, it keeps you grounded. You know where you stand with respect to the rest of the world. And secondly, the investor also knows that you have made a product keeping in mind that these already exist in the market, right? So we tend to get involved in our own company and our own product, but it's important to know what is happening in the rest of the world. And given that today's global structure, we are such a close-knit global economy, just because something doesn't exist in India but exists somewhere else in the world, it'll probably reach India faster than you make something new, right? So it's very important to be aware of what is happening. So competition. And third, very important, what is your market? Are you looking at, you're looking at villages? Are you looking at the government? Are you looking at large hospitals? Are you looking at standalone doctors? Who is your final segment? Because what you create and the way you market will, it'll depend on who is your target, and that clarity is very important. You cannot just come to a hospital and ask the procurement team to look at your product and buy it, right? You need that buy-in of the doctor. You need if it's a nurse, let her use it. Let the nursing staff use it for a month and then come back and say, they telling the management that, this is wonderful, this really reduced the time we needed to do something. That has a bigger impact than you trying to sell it to someone, right? So identify your target market, be very clear about your competitors, and definitely the problem statement has to be very clear. I think if you touch upon these three aspects and you're strong on that, any pitch would be absolutely fantastic if you cover that.
Okay, the folks out there, please note down the 3 points: the problem fit, and the go-to-market strategy, and the target segment. And the Ishita is allowed to invest in your startup.
Sure.
Then I have a few more points to add.
Yes,
So Ishita, is especially when you said, right, what is your market, and the famous term there is TAM, the total addressable market, right? And additionally, there is one more point which people generally, or 2 points people generally don't take very seriously, is what is your team and who brings what to the table, right? If you have your co-founders, or if you're a single person founding the team and building it, and then who has what expertise that you have built this team, and then how long they will sustain, right, with you on your idea, or is it a combined idea? And the other point is primarily on the money you are trying to raise. Where will you use and how long you think you will use it for, right? Because unless you are clear about, okay, these are my next 5 milestones, and then that's where I'll utilize this money and then possibly raise the next round, right? Because you cannot survive forever. And again, so there are key terminologies everywhere used, and it also has what is your runway. How long you will sustain with this money, right? There are 2 points, and though a lot of people, if now or later, will listen to the first point which Ishita mentioned, right? Meeting your customers, primarily meeting the doctors and receptionists, and is the most important point. I remember, though, being an engineer and building the product, I have been to clinics, met receptionists, understood how they do it, because otherwise, sitting in your office in some silo, you build some product and you think, oh, this the user will understand. Yesterday only on LinkedIn, we saw someone posting that a hose pipe and the person going below it, and was shown that, oh, user will understand, and not just walking over the hose pipe. And so visiting the doctor, visiting your customer, right, whosoever is going to be your targetable customer, and then understanding the need is very important. And listening to users, obviously. So we had this practice where we used to spend one day in customer success team. Being an engineer, being a product manager, or anyone, you got to sit there, listen to what your customers are saying, what kind of problems you are facing, and then you will know, you will have that empathy while building that product, right? And then you will think, put in yourself in their shoes and then build the product. So these 2 points I would share here.
Yeah, Kiran, just one more thing that I want to add here to what both Ishita and Ajay are saying. Truly, your ideation, it cannot be based on one event of a visit to a hospital and your personal experience. So it has to be, yes, how they have said. But what is more important is that what may be a problem statement today, you should be ready to revise it any number of times that you're doing it while you're building your product. Don't get emotionally attached and, and not be willing to change. So very agile in your idea as well as the product is being developed. You may have started with some idea, but your product will be completely different when you listen to this, and should be relevant. And number 2, when you think that this is not working, be very unemotional and cut it off. Stop the losses and move on. I think it's very important.
Completely agree to both the points.
pivot the business idea if it doesn't work. So rather than attaching to it, right?
Right. So if I may just take 30 seconds or more here.
Please.
In our early days, when we launched our first product, we used to go to, so it was for dentist, and we used to go to dentist and show dentist, doctor, if this is the product you would use. And they would, it was the hustle mode, right? In startup mode where you build, and they would suggest, no, this change this like this, and I would, if it is like this, I would use. You used to code the entire night and go again in the morning, doctor, now this is what you think would work, and accordingly meet every doctor, understand, and then change as time requires, and obviously whatever doesn't work, we need to drop it immediately. So
yeah, that's why your product saw the light of the day and is working.
Correct.
Yeah.
Okay. And then I'll put across this question to Professor Narayan. And then in terms of the investments, how do you find out the correct fitment, or how do you identify the investors of your choice, being in the research domain, coming from the IIT Madras team? And then do you think India has a vast ecosystem of the incubations to support the startups, getting benefited to the startups in terms of the investment connect, or how do you see the incubation ecosystem as a whole in terms of leveraging the incubation ecosystem and then growing ahead in terms of the commercialization aspect?
It's again a utilitarian oriented question or point that you had raised. And let me start touching upon the IIT Madras Research Park ecosystem, the bigger ecosystem itself here, which is the first university-based model ecosystem in the country, which was built upon MIT and Stanford model. And what we see here is, rather than standalone incubators or accelerators operating, so here it's more like a hub where we also invite established industries, like for example, Pfizer as a unit here. And there are also, we have Titan, we have Saint-Gobain. So all of these big companies operate along the same lines, where a startup as well as an MSME plus the incubators and accelerators as well operate. So this is more a give and take policy where each of us share some aspect or the other that is more utilitarian oriented for the other partner or the client. So with this, both the technicality as well as the infrastructural demands get more or less fulfilled. So having surpassed these basic requirements, which is very essential for healthcare, because I reiterate this point that I raised in my first clarification also. For instance, we had a startup that was developing more a diagnostic kit for a respiratory tract infection, which was not COVID. And then when the pandemic struck, they had to quickly bring out something that was more COVID related. And this required a huge amount of energy and infrastructure from them, which we were able to somehow or the other facilitate. But then when it went to the scale-up phase, this is exactly where they got stuck, especially even after getting validated from ICMR, somehow or the other, the kit was still hanging loose in order to enter into the market. And this is a very pitiful phase where neither we as an incubator nor the entire ecosystem in which we were associated could directly support. Having said that, the next point to bring in or attract investors is not just the sole responsibility of the incubator alone, but rather the whole ecosystem which functions in a beautiful way. So for example, I think Dr. Jain would pick up talking about this conclave, and measures such as these become very interesting, and also big entities like Apollo, which Ms. Ishita just talked about. All of these have to join their hands somehow or the other to first understand the needs of the startups that are working in the healthcare and how these needs could be channelized towards fulfilling the demands of the society as a whole. Because in India, ICMR or the Ministry of Health and Family Welfare as a whole, or Directorate of Medical Health Services, etc., or standalone bodies which somehow or the other devise the criteria for not just the utility as well as the circulation of the healthcare aspects. When we say healthcare, we focus both on diagnostics as well as therapeutics. And when we say diagnostics, this also encompasses biomedical devices. When we say therapeutics, this also encompasses approaches like theranostics, targeted drug delivery, inclusive big pharma sectors. All right. So somehow or the other, all of these guidelines which are devised to fulfill the demand and the scope of these products in the society become very critical, somehow or the other, the investors also need to be brought inside such discussions where the language can become much more fluid and flexible in order to bridge these gaps. So that's how I feel. And PPP, public-private partnership, is a key goal or strategy which needs to be operative, not just on paper, but in the true sense of its term, in order to support such startups, I think. Thanks.
Okay. And then adding to that, how critical is a life sciences startups to get an investment? Because probably the investors, if not the social impact investors, general investors would have an IRR at a faster pace, whereas in the life sciences stream of startups will have a long gestation period in order to de-risk the clinical.
Exactly.
What can be the bridge between a typical deep tech life sciences startups to be in this place of a typical private investor?
A quick proof of concept, which need not be, very systematically addressed, I would say, but rather convincing in order to move to the next stage. Because, I just saw this close by. So we picked up these USB kind of sticks where diagnostic devices have already started to move on to such limitations, So we have sequencers that are of the very similar size, and we have smartphones which can act as microscopes. So all of these are not just built only on infrastructure and on investment, but also on the technical expertise from the multidisciplinary and the intersectoral approach which I addressed earlier. So that is the key in order to move towards this prolonged gestation period and also the heavy investment that is required from people. And when I say multidisciplinary, it's just not technically multidisciplinary team, but also a wider multidisciplinary team involving investors, involving artificial intelligence people, etc., which can also save some load on experiments, some load on data generation, etc. So the balance between computational and wet lab is also a very critical key for such healthcare startups, which is being the trend currently, I think.
Okay, so the follow-up question, I'll put it to Dr. Nambiar. So one point of the funnel is the regulatory point of view. So how strictly regulated the device or a digital innovation group? So considering your vast experiences with the corporate hospitals and in the governments themselves, how do you see, should there be a flexible policy in terms of the regulatory point of view to accelerate the product from the lab to market? Are there enough policies in place? Because we see every new policy or every new guidelines coming in place in the DCGS, CITES, making it difficult for the startups to cross this barrier of research and then into the marketplace. Your thoughts, man?
So currently, our ecosystem is such that it is not very well regulated, and therefore, in a system which is very chaotic, you tend to have a lot of development which may never see the light of the day, and it's not well thought out. So when you say flexibility of policy, one is that of course we must have some policy and guidelines, and in those flexibility does not mean that it should be left free for all, or anything and everything can develop. We must ensure that there are statutory compliances and guidelines that are followed properly, that there is a proper gap which is being addressed in the ecosystem. These should be something mandatory, right? And then you can say flexibility in terms of how funding will happen to them. So once you've seen that some of these basic criteria are met, I mean, this is just to make sure that the investors have the confidence to put their money to back these, because you don't want to put good money behind some, after something bad. So therefore, you must ensure that some of these statutory guidelines, data privacy related concerns are addressed before you decide that rest of these things can be flexible. Yes, there should be flexibility in terms of the amount of grants that are available to them, whom they can approach, and there should also be a lot of support in terms of, I would say, the logistics behind going to the market. All of that should be flexible. Right. But where there should be no flexibility or consideration is not addressing the statutory concerns and the security concerns. is what I feel.
Okay, so
and there could be education by the government or other agencies towards this. If some startups, they do not know anything about many of the statutory guidelines are not known to somebody who thinks up of a great idea. So I think there has to be an educational support to them to say that, okay, consider these things, support them on this, and then the rest of the things, there should be a lot of flexibility in terms of allowing them meeting with the healthcare workers, giving them the right support. There should be a lot of flexibility in the environment for those.
Okay. I got it. So we have talked about different types of pitching and then the support of the incubator ecosystem, the regulatory point of view, and the educational or sensitization of the workers. So I'll go back to Mr. Ajay asking in the digital healthcare segments, what are the general things the startups should keep in mind? Because they say that we are going to build an successful app, making turning into a unicorns. Or what are the short pitfalls or the challenges you faced coming out of Practo, the major digital health platform? What are your advices for the entrepreneurs who want to work in the digital space?
So one point is similar to the question when you asked just to Dr. Uma, is on privacy and security, right? You can build for healthcare, but as long as you have not taken care of privacy of data and security of whatever data you're capturing from people, right? That's the first thing. Whatever you're building, as long as because we are talking about health tech, right, primarily, because and the customers will come, patients will come, and doctors will come to the platform and they'll share data. You cannot take security of data and or go other way around, that you start selling the data, right? Though data is oil, but when it comes to healthcare, it can bring your company down as well, right? So that is one very important point. And adding to this last point which Dr. Uma just mentioned, right, someone should educate us as well. That education is also something which we discovered ourselves over the years, right? If this guideline is there, or this is how we should be doing things, and not falling prey to any of the traps, right? So that education is very important. Primarily, if it is any startup, and generally in health tech, it is very important that though the doctors don't have fear that now that health startups will take our customers or data and or all those things, it's just that there's so many startups now, and if you some sales guy promised something and then you don't fulfill that, a lot of people have that thought process that now this new guy will also try to pitch me something and then say, sir, we'll do this, and doctor will change your clinic, will do all of these things, and then suddenly that guy has moved to another company, and then from that company also is pitching another product. So there is definitely a issue when it comes to what you are building, and then whether doctors should trust you or not. So that part of it is still there, because they are now everyone coming with another problem, right? And we have limited set of doctors, clinics, and hospitals. You cannot go anywhere else. It's not like selling milk or vegetables that, okay, in an apartment, if half of them buy from me and not the other half, I'm still able to survive, right? Or I'll go to another city, I'll go to another tier 2, but the doctors are doctors, whichever city you are building for. So as long as you know in your conscience that you are building for the right thing and you're not going to cheat a doctor, so either it is privacy and security because it's healthcare, and taking everyone along and not thinking that I will ride over this person or this team and this time and then become big, right? Healthcare, you cannot survive.
Okay. Adding to that, and then it's a follow-up question in the general digital space. So one of the attendees has also put up this question. How critical is a follow-on investment or investment in terms of an IP landscape? Is patent is really looked at as a great novelty factor for investments, or it's just a must-have kind of a thing?
In health tech, primarily, we don't go after patents generally when it comes to tech part. We can say we built a product, but the code is the IP there. I would not say the patent required in that case. If you have built a product for certain niche area and then you go for IP, then it depends on what you are actually building, and the pitch itself includes your IP. But so if I think of Practo, I don't think we have filed for any IP, patent in last 14 years. And because whatever you have been building is general systems, right? For masses, for people to come to platform, interact with doctors or book appointments and all those things. Possibly if someone else might be able to add more to this point here.
Probably Ishita or Professor Narayan, you can comment. So how critical does a startup need to have a patent for any investments, or how investors typically look around the IP landscaping policies?
Maybe Narayanan can add to this, because being in academic and R&D, this is something very important for us, right?
Yeah, Ms. Ishita, I'll just take 1 minute.
Sure, please.
So this again depends on the ecosystem. So be it life sciences sector or be it healthcare sector, when it is an invention that is demanding novelty to be proven to the investor, then certainly patent is becoming critical. Especially nowadays, given the competition, both from the investor side as well as from the novelty side, put forth by the startups, this is becoming one of the important criteria to bridge the gap between pitching by the startups as well as acceptance ratio from the investor side. Having said that, also there are some standalone innovations that are very indispensable in their own way, both in terms of the design of the make as well as in terms of the product portfolio to the market that it's going to cater. So in such cases, somewhere or the other, patent is not becoming that critical because the product speaks for itself. So you also mentioned about, the time taken for the European or the Western products to reach Indian markets, etc. But then there is also a tinge of novelty that can surpass this transition time very easily. So how these both are balanced decide whether a specific innovation or an invention will require a patent as a proof for securing an investment.
Okay.
So if I can just add from what I've seen, definitely I think Medtech is an area where we see more patents, of course, not so much on health tech, right? So devices, diagnostic panels, anything that requires new technology. And well, obviously a patent just shows that, you've done something first before someone else has done it, right? So that adds to the innovativeness of your product, and you're also protecting it from getting from someone else copying it and making it something different. So it's definitely an added value, but like Professor also mentioned, it's not a must. It's a positive, and it again depends on what kind of domain you're in. And how much value that holds. So an investor will always look the way we look for, does it have an FDA approval? Is it CE certified? Right? Those are the first few tick points that you look at. So if it is something new and you say, I already have a US patent and a Indian patent, and now I'm looking for going forward with XYZ thing, it shows that you've planned it out, or you are ahead of the rest of the market, and that could be taken as a positive point for an investor. Yeah.
Okay, so I'll be coming up out of a corporate, Ishita. So how do you see the general gap? How can a corporate help the startup ecosystem? Because you see many of the government initiatives, whether it is DBT or media or something. You have an initial Headstart grants, and then there are a few corporates. A typical example I can quote is Pfizer IT Delhi, where they chip in to fund the startups in terms of the grant to escalate from the POC to the clinical validation. So, do you see such kind of initiatives is good to have in at least considering the market space from the corporate portfolio point of view? Or what's your thoughts on that? So, is it good to have a good corporate structure initiatives to support the startup ecosystem so that the benefits of the ecosystem of the innovations can be reaped back into the Indian ecosystem?
Oh, absolutely. I think again, it depends a lot on the corporate's own thought process, right? How a lot of corporates prefer in-house innovation, and that's how historically they have done work. But I think increasingly a lot of them realize that the rest of the economy or the rest of the ecosystem is really moving fast. It's actually beneficial for them to work with startups and also have in-house, so things move in parallel. And that's why you'll see a lot of these, you mentioned Pfizer, they understand that it helps to move their own discovery process a lot faster if they can plug and play with some of the startups. So I think corporates that have realized that are now increasingly getting involved, whether it is through government projects or grants, or even working with innovation centers, incubators. So it is there, but there a lot more can still be done. And I can speak for our own doctors. In our own labs, we have three companies that we have incubated early stage. They have, we helped them get they got the BioTech big grant, then they went ahead and got the SIBRI grant. So they've reached a certain stage. But now there is a gap between the stage they're in and the stage at which they can actually commercialize it. And that stage, we're struggling to get funding for them, right? Because in life sciences, the time frame is so long. Nobody wants to wait that long. And after investing so much money and so much time, if it doesn't work, they feel their money is wasted. So we're really struggling how to do that. And I think that is where corporates can come in and definitely help bridge that gap, because you do have Series A and Series B, and you have enough people funding that. And now the government is pushing early stage through the big grants, through their other DBT forums. But yeah, that gap is there, and I think that needs to be addressed. So maybe corporates would be a good group of people to start with. Yeah.
Okay. With that, I would like to trouble you with your more. Can we expect some initiatives from your corporate as well?
Sorry, I didn't get that.
No. In terms of that, so as you said, the corporate, it's a good platform for a corporate to fund the startups which have a long gestation period. So can we expect some kind of initiatives from the Apollo's?
There are actually, though, those are things that are being discussed internally at this point. So I'm hopeful that in a couple of months, or maybe by mid of next year, we would have decided how to go ahead with it. But because we work with startups across the board, and when it comes to funding is where we also get stuck, because while we can provide some amount of funding, Apollo doesn't really fund startups at this point. But yeah, that is an area that is being discussed. We just have to wait and watch what is finally decided by the management.
Okay.
No, but it is because if people like Apollo, organizations like Apollo come into the fore, and what is missing in India is a number of social impact funding organizations. And Apollo from the healthcare field can actually lead the way and show the others how this is to be done, so that other funders have the confidence built into them. You need to actually have some leader to do that.
No, I completely agree. But at the end of the day, when you're a publicly listed company, there are certain, you have to look at your stakeholders, your shareholders, and the primary question comes. I mean, we faced that question a couple of times. Is that, your job is to provide healthcare. Why not concentrate all efforts, all money on that, and ensure that that is, you take that up to a certain level. I know there's a lot of discussion that can be done, that these startups can actually help you reach there. And but yeah, I mean, there are larger discussions there to be done. So like I said, hopefully we'll know very soon what is being planned on that side.
Okay.
So I can say, if you need support, we can come and shout outside Apollo office that.
Sure, I'll take you on that offer if it comes to that point.
How are we doing on time, Mukesh? So good to go to take a couple of questions, or how is it?
Yeah, we definitely can take some more questions there.
Okay. I think I'll check the Q&A in the chat box. So a question to Professor Narayan. Could you speak about the structure of the corporate model in the IIT Madras research and how it has been adapted from MIT or Stanford a little more in detail?
Good. So as we were discussing in the earlier points about the structured attempts to mimic a corporate model in order to bring efficiency both in terms of operation as well as in terms of output. IIT Madras Research Park ecosystem does operate on a completely corporate model. So usually we have quite some incubators or accelerators which are a part of this bigger research park ecosystem, all of which are private entities. So either they are, Section 8, Section 25 not-for-profit organizations, or sometimes we also have some centers of excellence or some of these incubators as a trust or society that operates by its own regimen. So the way in which the registration is done, or the way in which these ecosystem entities are projected, need not define the borders for these corporate models, but rather the way in which the operations are made systematic in order to achieve the end goals by a streamlining effort of both the technical as well as business mentoring in a given time frame is the right definition of the corporate models that we are talking about. And this is exactly how the operations are at least being attempted here in the research park ecosystem. And as I said before, it's more like a beehive model where we do have bigger corporates directly operating, and then we have the incubators or accelerators as the model corporate entities, and we also have centers of excellence that provide all the necessary technical as well as the business pool to it. But then what is truly lacking, but which is being currently addressed by even bigger funding agencies from the government, like DBT or DST or even SERP, for instance, or these centralized infrastructure provisions. For example, one can think CCAMP as a base model of such infrastructure provision, but what we require for healthcare startups is even bigger ones. Coming from Kiran Mazumdar entity, you yourself should be even more fluent with these kinds of demands that the healthcare startups require. And we are talking to a tune of a few hundreds of crores, when you list the cryo electron microscope, for instance, or when you list, LCMS, mass spec, and other equipment, for instance, each of which doesn't stop with just the buying or the operation of the equipment, but rather the maintenance and also, the associated manpower, the consumables cost, etc., that comes towards all this. But all of these are beautifully managed by corporates, of course, and this is exactly what the healthcare startups as well as the incubators that support the startups need to imbibe, I think. The way in which they operate, and very importantly, good that you raised that point, and very importantly to end this note is the sustenance model where all of these ecosystem enablers should move towards, including Headstart, for instance. So the sustenance model at the end of the day, where we become self-sufficient in order to operate, in turn to support the healthcare startups or any other startups for that matter, is the key for the Indian innovation ecosystem to move ahead, I think.
Okay, probably it's a follow-up question. So from Mr. Raman, one of the attendees. So in terms of the fund, this is a big challenge for the startups and the early stage companies who have just an idea. How should they proceed? What can they do and how can they get the government fund?
May I quickly just give a point there before any others have their input? Okay, so I think that the government, both in terms of central and at state levels, at central levels, we are talking about organizations like Startup India, and at state levels, every state has its own Startup Tamil Nadu, or, in Tamil Nadu, for instance, you have EDII, you have Guidance Tamil Nadu, you have Startup Tamil Nadu, all of these. And even incubators, we also have our own seed funds. So seed funds are the basic essential start kits for any of these startups that come up just with, boom, an idea or an innovation or a node of creativity rather. And all of us are happy to support such entities, with a good team strength, with the motivation and efforts to demonstrate well, and also with their own vision towards a proper market. So with all these, I think seed fund is the starting toolkit to support such entities.
Okay. Ishita, would you like to add something on this?
Yeah, I mean, I think that's right. Seed fund is the only way to really go, for like our own doctors, we also provide a small seed fund for them to come up to a proof of concept, and after that you can go to the government and other agencies and look for funding. I do understand there's a challenge to identify where do we get that seed funding, right? But today, I think the landscape has changed dramatically in the last few years. The number of incubators, accelerators that are there, the number of programs that are being launched by different state governments to try and promote startups in the country. If there is a lot more there, you will have to invest in terms of doing your research, figuring out who comes up with what proposal at what point. A lot of these are rolling, sessions that you can just apply at any point of time. But yeah, that homework needs to be done. But yes, seed funding is the only way to at least start, reach a proof of concept, and then you can actually hope to get better funding from different agencies.
Right. So in order to add what Professor Narayan and Mr. Ishita said, so there are plenty of schemes even to do an immersion. So there's a program called Social Innovation Immersion Program. I am a recipient of that fellowship as well. So government gives you a fellowship to identify the problems itself and then gives you a kickstart grant to start the startup. And then there is initiatives from Nidhi Prayas is what a 10 lakhs grant to do an hardware work of that. And the Startup India Seed Fund scheme is up to 20 lakh grant for the less than 2 years old startups. So there are many opportunities right out there to start a venture as such from the ideation phase. And then on top of it, we have plenty of incubators and accelerators to add value in terms of how it can be shaped in terms of a tangible out product, considering the market analysis and the go-to-market fit and so on and so forth.
And one last point, there are a lot of mentors also out there who are happy to help from their experience.
Right, as it really said, so mentorship is one other way where every startup or every individual innovator can leverage in order to streamline his own, her own problem statements or validation of the problem statements as such. Right, can we take one more question? And it's an anonymous question. Can we have a centralized team to advise on CIDISCORE or ICM or BIS processes so that the understanding and meeting the requirement is easy and clear? Today, the system is pretty gray and not well defined. Probably I'll ask Dr. Uma to start it.
No, I think this question is very valid because I've, had this question from a number of people. I mean, we have, even when we are evaluating many of the solutions, you find that this has been an area where most of them have lacked support and they don't know what is the next step. So this is an order. I mean, I think that there are organizations that should come together and there has to be some facilitatory body which people should be able to go to. I fully agree that this is a requirement. I'm sure the others on the panel might feel the same.
Okay, great. I think we have crossed the time, and then in order to add the funding part, so Headstart along with the Bharat Pitch.com is organizing an investment pitch. So folks out there, you can utilize this opportunity and then meet the investors out there and then get some mentoring support or any kind of activities in the startup ecosystem. This is the best place to start your ideation phase at least. And then it's tremendous hearing insights from all the valuable speakers. And then glad I was able to moderate the stalwarts in their respective domains. And then with this, I'll hand over to Dr. Jayant to do the formal launch of Impact 2.0. Over to you, Dr. Jayant.
So thank you, Kiran. Learned panelists for today's program. Ladies and gentlemen, very good evening to all. It was really wonderful session. This was one of the best panel discussion I ever attended. Almost like all panelists almost touched all the important points of I&E activities. So it's my privilege to have been asked to propose a vote of thanks and provide information about the Impact Conclave 2.0 on this auspicious occasion. Ladies and gentlemen, we are at Krishna Institute of Medical Sciences, deemed to be University Karar, doing a lot of research, innovation and entrepreneurship activities in healthcare domain. We have been supports all the interdisciplinary translational research, innovations, early stage startups to fulfill the unmet medical needs, which actually ultimately helps the medical professionals. And part of this, we are actually launching Impact Conclave 2.0 today. Basically, Impact stands for the innovation in medical, pharmaceutical and allied sciences for commercialization of technology. Basically, this particular program provides a platform and support to all the early stage startups, students, teachers, researchers, innovators, and all the enablers engaged in healthcare domain. So last year's we have launched this Impact Award in association with Headstart, SPPU Research Park Foundation, in which many ecosystem partners like AIC MUJ, IITM Bioincubator, AIC LMCP, OCHES Accelerator, and many others have actually involved in that program. So the program was very successful, as many early stage startups and individual inventors were supported through this program. So for the continuation of this kind of efforts of our university to support the healthcare ecosystem, we are very glad to launch this Impact Conclave 2.0 on this occasion. So this particular program will be hosted at Pune University on 7th and 8th October 2022 at the university campus. And this 2 days offline program will provide a platform and support to all the early stage startups and ecosystem enablers. So I would like to invite all the dignitaries and participants present on this particular forum to attend the event. The official invite will be sent to you, but it's a request you please join this particular program, and we'll share all the details in network. And obviously, I request you to share all these details to your network. So now I come to another important part of today's event to appreciate all the panelists. On behalf of Headstart Network Foundation and KIMSDU and other ecosystem partners, organizing team and wonderful audience, let me call it fraternity of healthcare domain together. And on behalf of on behalf of myself, I would like to thank you for all the gracious speakers for sharing all the important informations from your side. A big thank you to Mr. Kiran for wonderful moderation of the session and giving the introduction and outline of the program to our audience. I must mention our deep sense of appreciations for Dr. Uma Nambiar for her explanation on digital healthcare infrastructures and her guidance on regulatory compliances. Further, we are grateful to Mr. Ajay for sharing his views on telemedicine. He's nicely explained the challenges faced by the early stage startups in this particular domain. I may like to express our sincere thanks to Dr. Narayanan for giving an excellent coverage to the BioTech product commercialization and funding opportunities for the startup. I wish to express my gratitude to Ishita for her insightful views provided to young entrepreneurs to strengthen their research for the development of a startup. Finally, I would like to take this opportunity to thank you, all the organizers and attendees for making this event a grand success. So ladies and gentlemen, once again, I would like to thank all the panelists on this forum. We thank you for being with us in this evening. So it's been a great pleasure. Thank you so much.